overactive bladder is a very common cause of frequent urination. These patients can be very distressed. They oftentimes don't leave the home because they're so embarrassed by this condition. They can't sit through a movie because they have to get up so frequently to urinate. They are fatigued through the day because they wake up so many times at night to urinate. In some people, the brain's getting the wrong signal. The brain is getting the, I am absolutely full and I'm going to start to leak now. And that's when the brain sends out a signal telling you, get to the bathroom right away. We can change that signaling pathway through a process called neuromodulation, changing the nerve signaling. And there are two ways that we do that. One is a device called InterStim. There's also what's called tibial nerve stimulation, which is based on ancient acupuncture treatments, where once a week the patient will have a stimulation of the nerve behind the ankle, which can signal the bladder and get it to change its behavior. InterStim is among my favorite treatments. I've been doing it for over a decade, and there are very few treatments that I offer where I see patients that can be in this degree of distress have this degree of improvement. It can treat more than one type of patient. It can treat patients that are urinating far too frequently and leaking because they can't control the urge. It can treat patients who can't pass urine, not because there's a blockage like from a large prostate, but the bladder muscle just won't coordinate with the sphincter and they can't urinate. And it can also treat patients that have an embarrassing condition called fecal incontinence. I have patients that have come to me after suffering for years, very often having been sent from one doctor to another, given one medication after another, suffering with severe frequency, waking up through the night 8, 9, 10 times a night sometimes, wetting their pants. Not every one of them will respond as well as others, but I have had circumstances, and even had one last week, where I then put in the stimulator and immediately that patient, for the first time in years, slept through the night without having to wake up to urinate. And I'll tell you, that is satisfying. That's what brings me back to the office every day.